to the Merz Confidence to Be Me series. And this amazing series, I think, of 4 series is all going to be about women and women who rock. So these are the leaders in aesthetic medicine, some of the most inspiring women I know. And we're going to be talking in these 4 series about the role of women, what it feels like to be women in aesthetics, and particularly to take a leading role in aesthetics. We're going to think about what it's like to work as a woman. Do we work differently? We're going to think about the future of aesthetic medicine and the role that women will play in that. We're also going to talk about gravitas, like owning who you are and owning that position. But first, before we do that, in our first series, we're going to talk about leadership. And we're going to celebrate 2 amazing and inspiring women global leaders in aesthetics. And that is Cheryl Burgess, Dr. Cheryl Burgess from Washington, and Carla Pecora from Sao Paulo, Brazil. Hi, guys. So this series and in this particular episode, it is a bit of a celebration of you. You are amazing. I have to say that right from the beginning, both of you. You're inspiring. You are key leaders who have changed aesthetic medicine, the way we understand it, the way we practice it. So I just want to start that right from the very beginning. This really is a celebration. But I want to ask you a question right from the beginning, which is Cheryl, do you really feel I am an aesthetic leader? I am a global aesthetic leader. Do you feel that in yourself?
Yes and no. Yes, because I think, as far as being an aesthetic global leader, I find that first of all, you have to be able to present different things to the global population in a thought concept of what aesthetics are. And my little angle has been skin of color. And so I've excelled in knowing what the intricate things on what people have desired in different ethnicities as far as what's aesthetic for them. So that's why I feel, yes, I'm asked to invited to lecture all over the world because of the background and the information that I can provide on skin of color. So yes, in that aspect, yes. No, in the whole big scheme of things, I look up to a lot of other people who are colleagues of mine who have been at this much longer than I have, and I look at them as leaders as well. So I'm trying to find my place in the global aesthetic world, and I think I have something to contribute, which is basically skin of color needs and aspirations for cosmetic results.
And what is so interesting, Cheryl, is that for women, and people have shown that in research, that this need to leadership is about something. It's about contribution. It's about bringing a vision. And sometimes we find, and also in the research, that this is a kind of slightly different from men's idea of leadership. This wish and need to contribute is something that we specifically find in women leaders, and that kind of humble, well, I'm able to be here because I'm contributing on a specific thing is to be admired, but also is something that women really bring strongly to the table, that it's about something and not just about I don't know, like a positioning sort of thing, yeah, sure, I'm a leader because I'm important and I talk a lot. You know what I mean? I think there's that difference between men and women.
Yes, I agree.
And so, Carla, what about you? Have you embraced being a global leader, like a women's global leader, but a global leader in aesthetics? Does it feel comfortable, that title?
Kate, I'm still learning how to deal with this position, let's say. Uh, Not so far ago, I was used to look up to the leaders and think, okay, they are awesome. I would like to think in a different way as they are used to thinking. And some years ago, I started really working, presenting in the static field, talking mainly about toxin. And I realized that I could see things from a different perspective and that it may be something that I could contribute for this, in the static field. But for me, it's still a little bit awkward, you know. I'm not used to that. And when I see people coming to me, okay, I would like to know, to listen your advice. I don't feel comfort yet, but I'm learning. I'm learning how to deal with this position. And I totally agree with what you said, and also Cheryl. Um, Being a key opinion leader is not just a position; is uh, being there with a purpose to share knowledge, to contribute to the field, to help others to achieve the same path. So it's a little bit beyond the positioning and the name.
Yeah, I 100% agree. And I think this is key to partly what women bring to concept of leadership and also in actual leadership, because you see it all around the globe where there's many up and coming leaders. And if they're asked, like the younger KOLs, like what do they want to do? Like what's their aim? Often actually the result, they say, I want to be on the big stage. Like as if that is a thing in itself, as if it's but it's like, but what do you want to say when you get there? And what's happened is but for me anyway, when you look at some parts of aesthetics, there's a kind of sphere of aesthetics where there's a real mix of men and women colleagues. They work very well together. There's many strong women. And in actual fact, we start to look at the KOLs who are coming up. There's a lot of the new KOLs on the stage are men, surprisingly, are young men. Great, amazing. It's encouraging that we see such strong intellect. But what's happening is the women, to some extent, the younger women are kind of standing back, and not because what they want to do is contribute. They actually don't just want to be there. They need to have something to say. And I think this is somehow a difference between a little bit of a gender-based differences between those things.
When we talking about gender, we have different perspectives, different points of views. So we can be complementary. It's not an exclusive thing. So as being a woman, we are able to be sometimes more sensitive when we think about aesthetics, and also when we think about other women needs. This is something that I think it's a strength for us.
Yeah, 100%. And I think that acknowledging that 80% of our patients still are women, and that perspective and understanding other people's minds is specific. Cheryl, do you think that it matters? Like, does it matter the women's, or sort of a general women's perspective on aesthetics and where women have a vision of where we want to go? Is that important to have that voice, do you think? Is it important to have that balance?
I think it is important to have a balance, because women kind of know what women want. And I use this example when we're enhancing the lips. I can generally tell when a man has enhanced a woman's lips. I think women can put on lipstick in the dark. They don't even need a mirror to put on lipstick, because we know the shape of our lips and we just know how to contour. Men are injecting, I think, the way they may want our lips to look. Or they're easily persuaded when someone comes in with a picture and say, I want to have my lips look like this. So I think women, we can identify with other anatomical areas, but at the same time, I think we're more realistic in what a woman looks like versus, the glamour person that the man wants us to look like. And so that's just one example that I see in where women seem to be more in leadership of knowing about the contouring of the face and the lips and etc. versus men. Not that men can't do it, but I think we're in the forefront of that aesthetic aspect.
It's interesting, isn't it? As we talk about gender, we always struggle with generalizations, don't we? We're like, is this too much of a generalization? But we know clearly from studies that there is a difference between men and women, how they see, how they lead, how they will consult. There's gender differences. And I think that, well, some of these things, as you say, Carla, they're superpowers. This the blend. It's the fact that women will generally understand the minds of others, but in particularly understand the mind of other women. This is something which is a huge strength and power, just as you're saying. So I just want to just take a moment, actually, just to celebrate who you are in this world, and the fact that we say, oh, you are global leaders. It's a very, we can take on these titles. You don't, but some people take on that title very easily. But for me, both of you are the exact example of what true leadership is and true global leadership is, because you have amazing publications which have changed the way people think. Cheryl, you're talking about your Skin of Colour publications. I have read them. They changed my practice. They changed lots of people's practice. So you have not just I've seen you on the stage many times and learned many things from you, but you have a vision. For me, what leadership is that person should, instead of being like the posturing, they should be the person who sees the things that other people don't see, who understands the patterns and has a vision about where they want to lead people. And exactly what you've done, you have helped us understand that we had certain things in our mind, which was in the beginning of aesthetics was too focused on specific ethnicities, and you helped us and the whole of aesthetic industry to change by your lectures, but also by your significant publications. And it's really been inspiring because you have that vision. So you're exactly, you're such an amazing example of that, of leading. And Carla, same with you. So you saw talks in a different way. Like, as you say, you said, right, okay, I'm going to try and help people to understand. I have a vision about where we want to go. And then you pulled us all in that direction. This is leadership. And then you also have this other, which I think is interesting for younger physicians particularly. Like, you embody the full picture, which is like, it's everything. It's not like you didn't just put like a few little comments out on social media, like a few pert opinions. No, you publish, you speak, you take.
Also, I just want to interrupt for a second.
No, yeah.
We have been there from the beginning. So we know the history. And I think that's very helpful in how we look at things. Because someone who's just starting out, they don't know what collagen days were like. They don't know what the early botulinum toxin days were like. And so I think that's one advantage that we all have.
Yeah, I absolutely agree. Because, like, for example, not over-treating people, it helps you to understand where we came from, that we didn't always treat the whole face, that sometimes we only treated like a little bit, that fillers had a place. You didn't necessarily do every single thing with it. So, but 100%, it helps to people in context. It helps people understand that's part of leadership. So, Carla, if we think that Cheryl's saying partly what makes us good leaders is that we know the history, like we know where we've come from. And then that also helps us to be able to direct where we want to go, like in aesthetics. So for you, like, where should we be going in aesthetics? Like, how would you like aesthetics to change in the future?
Well, I totally agree with Sharon that from us to know our next step, it's kind of paramount to know the history behind how we could achieve that particular point. Even when we think about our particular story, or when we think about the static story from the beginning. All the static really started in the dermatology and the plastic surgery 20 years ago. So we have 20 years of story and we could improve and create a lot. But there is still a lot to change, a lot to create. And I do believe that we are following a path that aims at a natural result to recreate beauty. It's kind of a restoration of a painting, you know? We will try to make the original piece as beautiful as is possible from its conception. And for that, it's super important to know anatomy and to understand the more and more the products and how to work with regenerative medicine. So I think this is the way.
So what I think is interesting as well is then that if you think that we're saying is that, Cheryl, you're like, we use all that knowledge, we use all that experience that you've gathered and studied and created expertise in to be able to say, actually, where we're going requires really a fine set of skills. It's the opposite to like, I'm just going to do this, this, and this, and done. It requires a whole set of skills. And I think that we take that knowledge and that's where leadership comes from, by drawing on all that expertise and all that thought that you've put into it for all those years. And that's, I think, is really important.
Yes, I agree. I definitely agree.
And so, Cheryl, tell me your journey to get where you are just now. I mean, it's exceptional. So have you felt at any time during that the barriers that you might have come, the challenges that you had to go through, did you feel them strongly? Did you feel some of them were about being a woman?
I do. I think it was twofold, though. I think it was being a woman and being a woman of color. I had a lot of barriers. In fact, when I finished my residency, that was right at the time when the first filler was FDA approved in the US. And I was very interested in it, the artist aspect of me. I was really drawn towards this. And then in 1988, they had the approval of botulinum toxin, and I wanted to be involved in that. But it wasn't until like 10 years later that I just decided to do an investigator-initiated study, and where I, did it myself. And that's how I kind of got recognized. But it was a lot of hard work, and it was putting in 200%. And I just found people surrounding me or around me were getting, these studies and getting in these positions that I was being overlooked. And I think how it eventually kind of came around was that the proof is in the pudding, actually. My results. I had wonderful, great results. And when I would lecture, people are like, you did that? And I'm like, yeah, I did that. And so that was, I think, the beginning of when people believed in me. But, as far as I saw, some of the people who were contracted to do the studies, they weren't good injectors. Nobody was really good injectors during that time. So I think putting in 200%, showing what I could do from a physician and an artistic manner was what brought me to the forefront to be a leader in soft tissue enhancement and fillers.
So you did what classically is described as what women have to do, particularly, and as you see, women of colour even more, that you have to be much better than everyone else. So you have to be not 100%, 200%. You have to, and so what do you think about for young women coming up now? Maybe, I'm not sure if it's exactly the same position or the same disadvantages, but what advice would you give them, like, to be able to kind of get to the same level of achievement and leadership that you're in?
Well, now that there are a lot of women in leadership, I think I look for them in also putting in the hard work. I mean, nothing's easy. It's not an easy road. And like you were saying, some people want to be a global aesthetic KOL leader and they want to just get up on the stage and they have nothing to present. I think it's very important that you put in the hard work and put in your dues in order to move up. And I mentor a lot of people. I mentor especially women. And so when I came up, and possibly when you all came up, we didn't have mentors. So that's why we had to put in all that time. Now we're actually making it a little easier for women to come up. If they choose to do so, if they choose to have a mentor.
Yeah. And I think that there's some really interesting studies, like there's a Harvard Business Review, which really was discussing exactly this, which is especially young women in terms of their leadership skills and their ability to, all their abilities in everything that makes good leaders, they're the same as men. They even have some advantages. But what they lack in younger women particularly is the confidence, is pushing themselves forward. So they won't do that, or they won't see as definite an opinions. And I think to some extent, mentorship, like, it helps to support women to bring that aspect of them forward, like to bring that confidence that they can take those equal positions right from the start, like they have something to say. And Carla, for you, like in your journey in Brazil, I mean, obviously, partly what we talk about, we are global. So each of our environments where we've studied, where we've grown up, and where we've practiced aesthetics is also has different regional differences, effects. So for you, what's been your journey then? Like, what challenges did you overcome? Did you feel that was partly about being a woman?
Well, Kate, I do believe that I had, apart from being a woman, two big challenges. The first one is the language, because English is not my mother language. I speak Portuguese. Who else speaks Portuguese all around the world? So pretty few people. And I had to overcome this barrier. And for me, from my side, I had a bar here, and I thought that I had to achieve this high to be able to communicate. Up to the day that I listened to Stephen Dye, he was advising us on how to present abroad. So first, he talked to Americans to think about the attendees that will not be American speakers, English speakers. So that they had to take care about the presentation in order that the attendees would be could understand all the content. And then I asked him, wow, what about me? Because I'm a foreign language speaker. He turned to me and said, okay, listen to me. When I saw you presenting for the first time, speaking in English, all that content, I was mesmerized because you made a strong effort in order to communicate the content in a different language. So please relax a bit. And after that, it helped me a lot. And this is the kind of advice that I always talk to my peers in Brazil, in Latin America, that, okay, we've not heard, you can try to communicate, you make mistakes, but it's natural because it's a foreign language. And it's not that easy to communicate properly in a different language. So this was the first huge obstacle. The second one, that as being born in Brazil, we kind of suffer of the ugly duckling syndrome. You know what I mean? On our view, the best researchers, they came from US and from Europe, and not from Latin America. And we are used to think about that. So what could I contribute in this huge and important field, being a Latin American person? And after a lot of fighting and trying to understand how could I take part on this field, I realized that yes, there is a prejudice from the other side, but sometimes the prejudice is even higher from our side. And that we need to think freely and believe that we are able to contribute a lot as well. Because we have our way of practicing, of injecting, we have an open mind. We are super creative. So it's a different perspective, and everybody can benefit from both sides. And if we are able to contribute together, it's way better. But it was really difficult in the beginning.
And in fact, it's a great example, or it's a great, almost like a metaphor for women as well, because there was another study in Harvard where they said that much more men were achieving first, the male achieving first, than the women. Now, this was blinded. So they wouldn't even read, they don't even know who's doing the essay. So why is that? And one female professor said it was to do with this inner confidence to some extent, where the guys will tend to be very definite about what they're saying. They will tend to express controversial opinions and also be very forthright because they believed in their own, probably too much, believed in their own point of view. And this is the same. So what you're saying as well, coming from like where you have inequalities or a perception of inequality in terms of worth or impact or importance, then sometimes the person, or whether it's from nationality or even from men to women, you kind of like put yourself in that position and play the game as if that is the case. So and that's exactly right for women as well. They show many, many times. It's like, and that's why I think, as you say, the women leaders at the moment encouraging other people to be like, do you know what? You may think that you don't have anything to say, but you absolutely do. And it's really important and everyone needs to hear it. So, and this women's point of view, I think, is like super important. And it's interesting that all of these, because there's a debate, isn't there? Do women hold themselves back, or are they being held back if they are?
Yes, and if we think about a little difference when we compare women with men, think about a huge box. It's your head and a head of a man. The head of a man will open one box at a time because they are not able to do more than one task in the same time. We are able to open a lot of boxes and to deal with all these things together. We need to balance family, work, beauty, fun, everything in the same time. And this is a skill that we women, we do have.
100%. So Cheryl, do you think as women practitioners generally in aesthetics that somehow our own aesthetic appearance is more judged than our male colleagues?
Certainly so. I think that they want to validate that what we're saying is real. I mean, there's a lot of quackery things out there. And if I say something to my patients, I mean, years ago, we used to say, she had something done or she had plastic surgery. Now you hear people say she didn't keep herself up. It's a
Yeah.
whole different attitude of looking at cosmetic procedures. So when they look at a woman, we do keep ourselves up. We do keep ourselves presentable because our glass ceiling is so much lower than a man. I'm in Washington, D.C., downtown, where there's a lot of corporations and government and everything. And women are like put out to pasture if they look too old. So I think there's some women who seek out female cosmetic physicians because they know we're going to know about the procedures, we're going to know about the enhancement, and possibly we would have had them ourselves, where we can give a first line experience to what it's like and what it's going to do. Um, I will hear people go to men, cosmetic physicians or plastic surgeons, and there's no connection there unless there's a female in the office where they can say, yeah, I had it, or, I did this procedure. But when your consultation is with a physician and you don't see anything going on, that's like going to a dentist whose teeth are all jacked up. I mean, we don't want to see that. We don't want to see that.
But would you, if that was a man, would you say, for example, you go in, there's a woman, she hasn't had anything done, or a man who's had anything done, do you think patients are more judgy of the woman than of the man?
I have had numerous patients come to me and ask me, have I had anything done? Not to say that it looks like I had anything done, but they're saying, I like the natural look. And even if someone hasn't had any cosmetic enhancement done and they're a female cosmetic surgeon, I think as long as a woman looks like they're keeping themselves up. It used to be years ago when people were like, shamefully, you had something done, you had plastic surgery done. And now it's pretty much like people are saying she didn't keep herself up because we have so many things that we can do cosmetically that are non-invasive to invasive that can be done to keep your appearance up. And I was mentioning that I'm in Washington, D.C., downtown Washington, D.C., a lot of corporations, government, and women have a low glass ceiling. And women are trying to stay in the marketplace. They don't want to retire when they, say they have to retire. Men can grow old in their position. So women are out there seeking something to give them that competitive edge. And it doesn't have to be blown up where you look like you had something done. It's looking refreshed. The skin is glowing. The skin quality is great. We look at all those aspects. So it's not just fillers and neuromodulators. It's the overall appearance of looking kept.
So, Carla, part of being a global leader in aesthetics is our ability and to work with companies, to be a KOL for companies, to negotiate with them. Has that been easy for you as a woman to work in that corporate world?
Not at all, Kate, in so many aspects. I must say that it's not my natural environment. I'm a physician, so I'm not used to working in a company environment to deal with politics, competition, even talking about money. Negotiating is not natural for me. And I had to learn by myself how to survive in this environment that was pretty new for me. Apart from that, as a woman, I've been judged sometimes from some people from outside. Oh, maybe she's there in that position because she's a pretty woman, not because I have the knowledge. And I must say that I'm a hard worker, I'm a diligent woman, and I have a lot of to contribute in aesthetic field. And but sometimes because I'm a woman, I need to overcome all that and to prove myself. as someone that really deserves to be there. So not easy.
Yeah, and you certainly do deserve to be there. Obviously, being a global KOL means global travel and global communication. How's that been for you?
It's been pretty hard, pretty hard. In the beginning, it's amazing because wow, we are traveling all around the world. But after that, we need to balance our personal life, our private practice, the traveling, the papers that we are working on, and our family, my husband, and everything, and at the same time. So it's not easy to achieve the balance, and sometimes I need to ask for help.
So Cheryl, in your experience, like to get to where you are now, like what sort of challenges have you had to overcome? And do you feel some of them was as a woman?
Yes, I totally think it had to do being female, but also a female of color. And I had a lot of obstacles and barriers. For whatever reason, I felt I was capable of doing what everyone else could do, including clinical trials. And I was late to come to clinical trials. Actually, my first clinical trial was an investigator initiated trial that I put together with using a filler. And I think it was once I started lecturing about this filler, because it was fairly new in the US, that people saw my results and they thought that maybe I could do well in some of these clinical trials, and where they needed to show good before and afters and at least, 1 to 2 point improvement on patients. And, not everyone who's doing a study has the capability of giving you good results. So I think that's how I kind of entered into research 10 years after I really wanted to. So those are some of the obstacles and barriers that I had coming through, at being at the forefront of when the cosmetic procedures, non-invasive procedures, were just getting started in the US.
So you really had to work harder. So you had to do the classic thing as a woman and, as you say, a woman of color. You had to work better, harder than other people.
200%.
Too hard, like yeah. And I know that you've been, that when you think about that journey, that you've previously spoken about how it's important to do your time. So when you look and encourage and advise people who are coming up, young physicians, like how is it important to really do your time?
Well, I think, being part of being a leader, you mentor people. And, there are a lot of people who don't want to share because they think someone's going to steal their idea or what have you. But, I was always told that you pay it forward and what you get back will be tenfold for what you gave. And I've always grown up in that sense of notion that you give, and therefore I'm not afraid to take someone under my wing and mentor them. I think it's best for the specialty. I think it's great for women because usually most of the mentees that I have are women. But I really do think that's very important to continue the education along, the pathway of women getting truly involved in it. I think there's a lot of imposter syndrome that women go through, and that they're not capable or they're not worthy of. And a lot of that needs to be overcome. So being able to communicate and talk to another woman who may have gone through those adversities is very helpful.
Yeah. And I do think that is something that women leaders specifically bring, like yourself. The bringing that culture of encouragement instead of a culture of competition. I have heard male colleagues of mine saying about being on stage, for example, that it's like, well, there's only one king on the stage. Only one person owns that. And I was like, really? Really? And I think that is, and as we know from certain types of male colleagues, that sometimes even after a presentation, it can be very adversarial. It can be very, like the questions, the type of, like as if you're now you're on the firing squad, now we're going to take you down. Like that is the kind of opposite culture to the one that you're describing, which is mentorship, which is giving away. And for me, the women leaders, and you both embody that, is very much about sharing knowledge, and everyone improves from that. So Carla, there's so many amazing women in aesthetics, young women that are coming up who would like to impact and make a difference to the future of aesthetics. So for you, what is the most important thing that they should do to be successful?
Well, the most important thing is difficult to say, because I do believe that it's a combination. My advice for these young women is to be committed, dive deep in your study, believe in yourself, acknowledge the work of others, listen to others. The small tip, even such a small one, can be super valuable for you in the future. And above all, believe in yourself. Two women can go way farther than just one. So we need to be together.
Fantastic. That's great. Thanks, Carla. And Cheryl, as a visionary leader in aesthetics, who's, as you see, been there in the formation of our field, like when you see how we're evolving, what do you wish for us? Where do you wish us to be, and where do you wish us to go?
I think the forward direction of this industry is becoming more inclusive. I do this lecture on cultural beauty around the world, and we have to take into account culture as well, and learning about different cultures and what beauty means to them. It's not what we may think or what we may imply that the patient needs, but it's what their culture implies. I think the single most thing that I found in all cultures was the color red. Every culture incorporates red into something, which I had no idea. But learning about different cultures around the world, not everyone is into the body contouring, or, the sharp jawline, or the, waist to hip ratio, as, say, Europeans are, or the US. The US is a melting pot of everybody around the world. And living in Washington, D.C., amongst the embassies, I see that. And people may come in for specific things that we think, oh, why are they like paying attention to their earlobes, for instance? And in Asian culture, that shows prosperity, and they want filler in their earlobes. So those are the kind of things that I just see in the future, that we'll be more recognizable as part of the enhancements that we do. Learning about someone's culture before we actually pick up a syringe,
Yeah.
I think is very important.
I think it's really important, and I think only with a person and with leaders who have truly global perspective, like you've been lots of places, you've heard it, and you bring that home, so that we treat our own patients, and they're often diverse populations, with more sensitivity. So this is great, and it's a great goal. So thank you so much, Carla in Brazil, and for Cheryl in Washington. They are amazing and inspirational women leaders. They are changing aesthetics, and I think we can see that we're in safe hands. See you next time.